Hi everyone, my name's Dan Fitzpatrick. I'm a sport and exercise medicine registrar in the London Deanery, and I've had the great pleasure of helping to organise the musculoskeletal stream at this year's BASEM Conference in Coventry in November. We're all really excited with the lineup of speakers we've got. We think it would be really valuable for people working across MSK. On the first day, we've got a brilliant set of talks about the unique challenges in treating and identifying injuries in our younger patients through adolescence and childhood, and thinking about not just the pathologies that they have, but the challenges of trying to help this really important group of patients to stay active throughout this period of life and then later on into their life, so we can hopefully influence their overall health. Following that, we've got what should be a brilliant talk looking really in depth into what can be really tricky injuries to manage, stress injuries of the pars interarticularis, and who better to get it from but the group of people that probably see the most, which is the England and Wales Cricket Board. So we're going to hear from loads of experts from there on the work they've done over years looking at these and tracking these through, and I think some insights that I know I'm really looking forward to hearing from and taking back to my work in football, where we see them but nowhere near as much. So I think we're going to hear some really valuable insights in this session. And then we're finishing the day thinking a bit more about what can we do as practitioners in MSK, and how can we help them, and focusing a bit on injectable therapies, trying to cut through what works, what doesn't work, what's there evidence for, what's there not evidence for, and how can we use these to help us form a treatment plan for our patients. And I think we've got some real experts talking about different ways that we can use these. Then on day 2, we've got a fantastic session thinking about the specifics of injury prevention and injuries in female athletes, and looking at the program, we've got some amazing names speaking and with a huge amount of expertise in this area, so that should be brilliant and a lot of take homes for people. And then we finish the day with a session I'm really looking forward to on conservative management of ACL. So we've got, again, some fantastic researchers and clinicians talking about what the evidence shows, and also some really exciting new developments, including the cross-bracing study and one of the key authors of that talking us through how that could be applied in our practice. So if you haven't got a ticket already, I'd really encourage you to have a look and sign up for one day or both days. I think, aside from all this great content, BASEM's a great place to meet and network, to catch up with old colleagues, new colleagues, make new friends, and I'd really encourage anyone to come along. So have a look at the programme and hopefully we'll see you there.